I'm Bradley Wolf from Cincinnati, Ohio, and I've been practicing exclusively hair restoration for 32 years. And I'm going to be talking about the recipient area. You'll hear a lot about the donor area at conferences and in the social media and the press about the different techniques of harvesting the grafts, FUE versus FUT, but you don't hear a lot about the recipient area. That's the recipient area is where the grafts are placed. And that's equally as important as the donor area. You can get, it doesn't matter if you get perfect grafts out, you get a lot, and you put them in, it doesn't matter how long it takes to get them out or put them in, but they have to be put in. A great graft can be ruined if it's not transplanted well. So the growth isn't dependent as much on the donor method as those who are placing and the treatment of the recipient area where the grafts are placed. And that includes the hairline. The hairline is what people see when they look at the patient. So, the patients are trusting us with their appearance. So, and the hairline is the first thing people see. So it's important in the recipient area to know how to design a hairline, how to build a hairline. Hairlines are built from a transition zone of no skin, and behind the skin at the skin interface, there are 1 hair grafts, and then 2 hair grafts, and 3 hair grafts. So the grafts are broken down into different sizes. You don't want a 3 hair graft right in the hairline. That can look obvious. We want it to look natural. So we start out softening the hairline with single hair grafts for about maybe 1/4, 1/2 inch, and then 2 hair grafts behind that. That replicates a normal look. So there are little incisions made in the recipient site, or sometimes implanters are used to just directly implant the grafts into the area where they're going to be growing. So there are multiple ways to place the grafts in the scalp. But regardless of the different ways, the person who's doing it needs to have experience. Oftentimes, if incisions are pre-made, then surgical assistants will place the grafts, which is perfectly legal. So it's important that they're experienced and that they work with their physician as a team. And it's really important that they care. They're very interested in getting the best results possible, because a lot of the complications that we see with infection or ingrown hairs, with grafts that aren't growing, are because the grafts aren't placed well. They're either placed too close together, or they're placed not deep enough, or too shallow, too close together. So that all determines the outcome. It also, when the hairs grow, they have to grow at the right angle. They have to be placed at the right depth. So each patient has to have the grafts measured as far as the depth, as far as the width, and as far as the spacing between the grafts. Those all are going to determine the result, and it's going to determine how natural it looks. If you make an incision that's too shallow and jam a graft in, it can either not grow or come out all kinky. It disturbs the outer layers of the hair. It may grow, but it may grow thicker, it may grow coarser. That is called post-transplant kinkiness. That sometimes occurs. So we want to put the grafts back in the skin as closely as possible to the way they were before we took them out. It's difficult, not impossible, it's difficult to get it perfect. We can't make it look like it looked before. We can't attain those densities, but it is possible to make it look very good, to get acceptable cosmetic density. But it's so important to place the grafts in so they're not damaged, so they're at the right angle, they're at the right depth, the hairline is designed at the right place. You don't want people that are looking at that patient to notice their hairline or start looking up at the hairline. And that often occurs if the hairline is placed too low. But essentially, no matter where the grafts are placed, it's very important to have a skilled team with experience and someone who cares about it, because it's equally as important as the donor area, if not more important. And a lot of the problems we see with poor growth or other problems are due to problems with placing the grafts.